The second lecture on optimal use of ultrasound will be on quality of parameters. The parameters that I will try to cover will be spatial, contrast, and temporal resolution, and some additional methods that increase ultrasound quality. Spatial resolution is the ability of a system to discriminate 2 points or 2 lines. For ultrasound, there are axial, lateral, and elevational resolution. Axial resolution is the resolution along the direction of the sound propagation, which means the discrimination of 2 points in 2 different depths. It's related to the pulse duration, wavelength, and frequency. With low wavelength, which means high frequency, axial resolution increases. The second is the lateral resolution, which is the resolution perpendicular to the direction of sound propagation, which means discrimination of 2 points side by side. It's also related to wavelength, frequency, and transducer diameter. Near field length and far field divergence are also important. The third one is the elevation resolution, is the third plane perpendicular to the sound beam and transducer, and it's related to the transducer's shape. With increased frequency, we know that wavelength decreases, so smaller objects can be more detectable because wavelength is the major determinant of tissue interaction. So the spatial resolution increases. With increased frequency, interaction of ultrasound beam with tissue increases, so the absorption increases and penetration decreases. High frequency transducers have higher resolution, but they also have higher absorption and lower penetration. Deep tissues cannot be evaluated with high frequency transducers. The second parameter is the contrast resolution. Contrast means the differences of echogenicities or delta echogenicity, which means the ability of the system to discriminate 2 different echogenicity levels, and is affected by brightness, dynamic range, grayscale maps, focusing, the number of focus used, and high frequency transducer use. Dynamic range is the range between the strongest and weakest echoes. Echo intensity is displayed as different shades of gray. A wide range displays more shades of gray and a smoother image overall. A narrow or small range displays more black and white image. These are the dynamic range values, very low. You see black and white tones. And this is more gray tones, but this is an optimal one for discrimination of echoes from each other. So higher dynamic range does not mean the good one. Optimal dynamic range optimizes the contrast. The other parameter is the grayscale maps. Dynamic range defines the total number of grayscales displayed. On the other hand, gray maps determine which signal intensity is displaced in which grayscale. It determines how light or how dark preferred and adjusts the brightness of each shade of gray. These are 3 examples with the same dynamic range in 3 different maps. This map prefers more white tones, more gray tones. It's upon the user's preference. The third one is the temporal resolution, which depends upon the frame rate, line density, image section, zoom, and the use of persistence. The term persistence defines how much of the previous image is taken over into the current frame. There are some additional methods to increase ultrasound quality, like tissue harmonic imaging, speckle reducing algorithms, and compound imaging. Tissue harmonic imaging considers the harmonics of echo, the second and the third reflections of the sound during image processing. Harmonics of echo includes less artifacts, so by using tissue harmonic imaging, artifacts can be eliminated, particularly the side lobe and reverberation artifacts. On the other hand, harmonics are low amplitude echoes, so signals from deep tissues are lost. There are some speckle reducing algorithms that detect weak and strong echoes, which eliminate the weak signals and enhance strong signals. So the speckle is eliminated, a softer and clearer image is obtained. Compound imaging is the advantage of broadband technology, which acquires multiple frames simultaneously from different angles or frequencies. The same area is sampled more than once in various angles or frequencies, which increases the signal-to-noise ratio. So the background noise and speckles are suppressed, and the artifacts are eliminated, which improves resolution and contour display. On the other hand, temporal resolution and lateral resolution at the edges decrease. Knowledge of quality parameters in ultrasound is necessary for an optimal imaging. The next lecture will be about optimization of ultrasound parameters. Thank you for listening.